Dr. Jeffrey Spiegel, facial plastic surgeon in Boston, Massachusetts. And we're going to speak a little bit about forehead modification surgery for gender confirming, or for FFS as it's called, but really it's a procedure that shapes the forehead to its most attractive feminine shape. And if you have a bit of a brow thickness, an overhang here, eyebrows that are very low, thick ridges that make your eyes very shadowed, that can make you look unattractive, very masculine, somewhat sinister. Think Arnold Schwarzenegger's forehead. And there is a procedure that we do which can modify your forehead to a very attractive feminine shape. Now, it's part of FFS, or facial feminization surgery. That's where it's commonly done. Many women who look somewhat masculine, transgendered women who want to look very feminine, it's something we do. And really, it's just all part of plastic surgery and helping you to look the way you should look, helping you to look the way you feel. Now, I've been very fortunate in that we've designed a procedure that has been very, very safe and highly effective. I'm very proud that in 2010, the Triological Society, which is an honor society for head and neck surgery, gave us an award for my work on forehead surgery. And we have had people come from all around the world for this operation. What does it do? The goal of this surgery, as I mentioned earlier, is to set your forehead back. Many people tell us they've consulted with surgeons who said they're going to use a drill or some other sort of rasp or power instrument to simply sand the forehead back. Now, that doesn't work always. It can work sometimes, but you just don't know when it's going to work. The problem is that your forehead has a sinus in it, the frontal sinus. Now, a sinus is an air-filled pocket. It's between the bone here and the bone in the back is this air. If you have very thick bone that's making the brow ridge and you sand it back, that's fine. But if you have an air pocket and you sand away the front of it, well, it's like sanding away one side of an egg. You open up into the middle, and then you end up with a depression, which is not what you're looking for. Sometimes people will sand it down to where it looks pretty good, but in doing so, you've gotten very close to the sinus and you've made it very, very thin. And I think that that's not necessarily the safest thing to do, because you'd like to have nice thick bone, which is not going to be a problem if, for example, you bump your head, which people can do, accidentally in any situation. What we do is a combination of things. We use a drill to shape the bone when you can, but I also am prepared to set the bone back. This sounds very frightening, but it's actually a very quick procedure. The whole operation takes an hour and a half to 2 hours. And in this time, we set the bone back, we secure it in place using the bone that was removed as a form of biological paste or biological cement, and sometimes a tiny titanium screw or plate. These are 1.2 millimeters in diameter, so they're very, very small, and they tend to be unnoticed for the rest of your life. Once we've set the bone in the proper position, we shape around the eyes, around here. We set the eyebrows to a position that's very attractive. Now, I get asked a lot, once you've set my eyebrows, am I going to look surprised? And indeed, if you raise your eyebrows, you do look surprised. But that's because you're raising your eyebrows over the bone that's there, and people can tell that your eyebrows have been lifted by where they are located relative to the bone underneath. Once we've adjusted the bone underneath, your eyebrows are sitting in a very natural spot, and while they are higher than where they are before, you can still elevate them so they seem absolutely natural. At the same time, we can shape your hairline to a very attractive shape. If you start to get some recession in the corners of your hairline, that can be corrected to a much more curved and natural feminine appearance. All that is done with a very, very safe operation. As I mentioned, it takes about 2 hours. There's a risk of numbness on the top of your head. It's not even a risk. We can pretty much guarantee you'll have temporary numbness from the incision. But the best research that's been done has shown that within a year at most, or sometimes a little longer, the nerves are healed to the point that it's the same as if you had had an endoscopic surgery or any other type of procedure. It heals beautifully. The incision heals very, very fine so that you can wear your hair back. And your eyes look much more open and feminine. It's probably the most important procedure of all of them for looking feminine for the bulk of people. If this is something you've been thinking about, and whether you're a woman who was born as a woman, who's found that maybe her eyes look somewhat heavy and masculine, or her eyebrows look kind of heavy, or she's got a high hairline, or if you're a transgendered woman who wants to look softer, or if you're a man who feels that you look somewhat harsh and sinister, we're happy to talk with you, answer any questions you may have. You can find us on the internet at drspiegel.com, drspiegel.com, or feel free to call us at 617-566-3223. and we'll be happy to answer any questions.